Hi, my name is Maddie. I'm going to be a student nurse today. I'm going to be giving you a physical assessment. Now I'm going to provide some privacy and close this curtain. This sheet of paper is for documentation purposes. It's blank. All right, can you state your name and date of birth for me?
Marley Johnson, December 2nd, 2002.
All right, I'm going to go wash my hands real fast. Like I said, I'm going to be giving you a physical assessment. You have the right to refuse anything we do today, and you have everything we do stays between us. All right. What's today's date and year?
September 7th, 2022.
All right. What city are you in?
Columbus, Mississippi.
And who's the president?
Joe Biden.
All right. Can you raise your left hand? Can you raise your right hand? All right. Patient is awake, alert, and oriented ×3. They can follow verbal commands, and speech is not slurred or stuttered. So I'm going to check your eyes real fast. I'm going to look at your pupil size. So if you don't mind just looking at my nose. All right. Pupils are about a 4 right now. Okay, now I'm going to shine a light in your eye to see if it constricts. All right, I'm going to shine the other eye. All right, both pupils constrict. If you don't mind staring at that P right there, and when I tell you to, stare at my pen light, okay? Look at my pen light. All right, pupils are round, reactive, equal, and round, reactive to light, and equal, and accommodation is present. I'm going to ask the patient if you don't mind standing up, and we're going to do the Snellen chart. The patient will walk 20 feet away, and if you don't mind covering your left eye for me. Can you read this line?
TOZ.
What about this one?
PEFCD.
What about this one?
FELOPZD.
What about that one?
DEFPOTEC.
Okay, can you cover your right eye for me? Can you read this line?
LPED.
What about this one?
EDFCZP.
What about this one?
DEFPOTEC.
All right, you can uncover that eye if you don't mind reading this line.
PECFD.
What about this one?
DEFPOTEC.
All right, this visual acuity is 20/20 in both eyes. If you don't mind coming and sitting back down for me. Now I'm going to check your ears. I'm going to make sure they're both symmetrical on either sides. They are. I'm going to check, make sure they're in line with the outer canthus. Both ears are in line with the outer canthus. There are no lesions or masses present, no earrings in. All right, now I'm going to move to the nose, make sure it's symmetrical on the face. There are no lesions or masses present. Okay, now I'm going to shine my light up your nose to look. All right, turbinates are patent and pink. No lesions or masses are present. Now I'm going to move to your mouth. If you don't mind opening your mouth for me. Buccal mucosa is pink. There's no lesions or masses. Can you smile for me? All right, all teeth are present and clear. Okay, gums, they are pink and not swollen. Can you stick out your tongue for me? Okay, tongue is pink, no masses, lesions present. Can you stick your tongue in the roof of your mouth? Floor of mouth is free of lesions and it's pink. Okay, can you stick your mouth out and say ah? Ah. Hard palate and soft palate are both normal. Uvula is midline and tonsils are present with a grade of 1. Can I check your gag reflex? Okay, patient deferred gag reflex. I would stick the tongue blade as far back as I could to elicit a gag. Now I'm going to move on to the neck. Check the skin for any lesions or masses. Patient does have a few freckles on the right side, but no lesions or masses are present. There's no lumps. Let me check for pulsations. No pulsations are present. Now I'm going to check your carotid pulse one at a time. Carotid pulse is strong, 2+ on both sides. Now I'm going to also take for bruise. I'm going to use the bell. If you don't mind holding your breath. All right, no bruise are present. Now I'm going to move to the posterior chest. I'm going to check the skin for any lesions or masses. Patient does have a few freckles on the upper chest. Check to make sure everything is symmetrical. Now I'm going to palpate for any kind of tenderness. Is any tenderness present?
No.
No tenderness noted. Now I'm going to also take for breath sounds. Take a deep breath for me. Another deep breath. Another deep breath. Another deep breath. Another deep breath. Deep breath. From the outside, I'm going to move a little further out. Deep breath. And lastly, deep breath. All right, now I'm going to percuss for CVA tenderness. I'm going to find that angle, and I'm going to percuss. Any tenderness? No? Okay. I'm going to do the other side. Find that angle. Any tenderness?
No.
No? Okay, no tenderness present. And I'm going to move to the anterior chest. I'm going to inspect for respirations and count them. You'll just take normal breaths for me. All right, respirations are normal and labored, and respiration rate is 16. Now I'm going to inspect the rise and fall of the chest and for symmetry. It is normal. I'm going to inspect the patient's skin. There's no lesions or masses present. Now I'm going to do the same thing and also tape for breath sounds. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. All right, breath sounds are clear and unlabored and equal on both sides. Now I'm going to move to the heart and listen to heart sounds. I'm going to use the diaphragm first and then move on to the bell. S1, S2 present. S1, S2 present. S1, S2 is present. And S1, S2 is present. Now I'm going to move to the bell, work my way up. S1, S2 is present. S1, S2 is present. S1, S2 is present. And S1, S2 is present. There's no extra heart sounds or murmurs. Now I'm going to check the patient's upper extremities. I'm going to first test the muscle strength. So if you will grip my 2 fingers for me, all right, and if you put your fingers together like this, and if you try to pull them apart, okay, muscle strength in the fingers is a 5 out of 5. Now I'm going to check the arms, if you'll do this. Okay, try to push against me. Okay, try to pull against me. Muscle strength in the arms is a 5 out of 5. You can place your arms down. Now I'm going to get you to shrug your shoulders. Can you shrug your shoulders for me? Okay, now I'm going to place this and apply pressure if you'll shrug them. Okay, muscle strength in the shoulders is a 5 out of 5. Now I'm going to palpate the radial pulses. So if you'll just stick out your arms like this. Radial pulses are 2+ strong bilaterally. Now I'm going to palpate the brachial pulse. All right. Brachial pulse is 2+ strong bilaterally. Now if you'll hold out your fingers like this, I'm going to check the capillary refill in all of them. Capillary refill is less than 2 seconds in all fingers. Now I'm going to test the range of motion, so you can wave bye to me. Alrighty, range of motion fingers is full. Can you stick out your arms like this? Can you move your wrists in, move them out, flip them up and down? Range of motion in this wrist is full range of motion. Now the elbows, can you bring your elbows up for me? Can you straighten them out? Can you put them up and like this? Okay, range of motion, elbows is full. Shoulders, can you bring them up to your side for me? Can you bring them back down? Can you bring them straight up and out? And then straight down and as far back as you can. All right, range of motion in the shoulders is full. Now I'm going to move to the heart again and listen for the apical pulse. So if you don't mind laying down for me. First I'm going to palpate the apical pulse, and then I am going to auscultate it and listen for the heart rate. Apical pulse is 2+ strong. Apical pulse and heart rate is 80. All right, now I'm going to check the abdomen. I'm going to make sure the contour of the abdomen, it is flat. Make sure it's symmetrical. There's no lesions or masses present. There are no pulsations. All right, I'm gonna check the umbilicus. There is no hernia, no drainage present. Now I'm going to assess breath sounds in all 4 quadrants, starting in the lower quadrant. Breath sounds are normoactive in all 4 quadrants. Now I'm going to lightly palpate on all 4 quadrants to assess for any tenderness. Let me know if you have any tenderness. No tenderness? Okay, now I'm going to deeply palpate all 4 quadrants to assess for any tenderness or masses. Any tenderness? No tenderness present. I made a mistake earlier and I'm going to reassess the apical pulse for a better reading. Apical pulse is 2+ strong. Apical pulse is 82. Now I'm going to move to the femoral pulse. Can I palpate your femoral pulse? Patient deferred, but I would place my 2 fingers in the groin area and palpate and grade the pulse. Now I'm going to move on to the lower extremities. First, I'm going to assess the skin. Patient does have a birthmark. There are no lesions or masses present. There's a few scars, but no freckles or bruising. There is no hair present. I am going to look for varicose veins. No varicose veins are present. I'm going to palpate the temperature of the lower extremities. Legs are cool. I'm going to assess for edema. So I'd place my finger right there. No edema. No edema present, so a grade of 0. Then I would palpate both popliteal pulses. Popliteal pulses are 2+ strong bilaterally. Then I would assess and palpate for the posterior tibial pulse on either side. Posterior tibial pulse is 2+ strong bilaterally. Then I would assess and palpate the dorsalis pedis pulse. Dorsalis pedis pulse is 2+ strong on both sides. Then I would assess the patient's feet. No hairs present. I would check in between each toe. No scrapes or bruising. I would check the soles of the feet. Alrighty, feet are normal color. There's no lesions or masses present. Now I would assess the muscle strength. So if you'll flex up your feet for me. Okay, can you push against me? All right, can you pull against me? Okay, muscle strength in the feet are a 5 out of 5. Now for the legs, I'm going to push down if you'll try to pull up. Okay, try to pull up. Muscle strength in the legs is a 5 out of 5. Now I'm going to assess the range of motion. Can you wiggle your toes for me? Range of motion in the toes is full range of motion. The feet, can you flex your feet up? Can you point them? Can you bring them in? Point them out. Range of motion in the ankles is a 5 out of 5, strong. Now in the legs, can you bend up your knee for me? Can you bring it back down? Can you bend it back up again? All right. Can you point out your hips for me? Turn them out. Can you bring them in? All right. Can you bring your right leg out as far as you can to the side? Okay, you can bring it back in your left leg. All right, full range of motion in the knees and hips. Now I'm going to assess the range of motion of the patient's spine, so I'll ask you to please stand up for me. And you face away from me. Alrighty, can you bend down and touch your toes for me? I would assess to make sure the shoulders are in line and hips are in line. Alright, can you stand up for me? Can you lean over to your left? Lean over to your right. And can you bend as far back as you can? Alright, spinal range of motion is full and scoliosis is negative, so patient does not have scoliosis. Alright.